Hello everyone and welcome back to our channel. So in this particular video we shall continue with the female reproductive system and we shall consider the topic parturition or labor as it is known as, or the childbirth. Okay, so labor, it is the process by which the fetus is expelled from the uterus through the vagina. So we have seen what are the alterations which take place and how the fetus grows in the mother's womb or the uterus where the implantation takes place, right? So after the completion of 9 months or after the completion of the term, the baby which is fully grown, it is expelled from the uterus through the vagina, and this process is also referred to as giving birth, or another term for this is parturition. Parturate means childbirth. Okay, so this is the position of the baby after the completion of the full term of the pregnancy. So as you can see, the head of the fetus, it is projected towards the cervix. Okay, so the baby, it is positioned in such a way that the childbirth is facilitated. Okay, so baby, it moves out of the womb through the cervix. Now the onset of the labor, it is determined by the interactions of several hormones, that is the placental and the fetal hormones which are released. Okay, so the changes in these levels of hormones are actually responsible for the onset of the labor or initiation of the labor. Okay, so usually these are the levels of hormones throughout the pregnancy. Okay, so initially, as you can see, that the human chorionic gonadotropin HCG, which is detected in the maternal blood and the urine, which indicates that the pregnancy has occurred. It's actually an indicator. Okay, so this particular hormonal levels, it is high until 8th week of the gestation, right? Okay, then further as the pregnancy continues, as you can see, the hormones progesterone and estrogen, the levels of both these hormones is increasing throughout. Okay, so both these hormones, these help in maintaining the layer, that is stratum functionalis, right? So the decline of these two hormones will result in the slowing of this particular layer, stratum functionalis, right? So this levels of both these hormones, it is kept high, it's going on increasing throughout the pregnancy. So also it prevents the contractions of the uterus. Okay, so high levels of progesterone, it inhibits the uterine contraction. So unless and until the levels of progesterones are maintained high, contractions of the uterus will not take place, so labor cannot take place. Okay, and unless and until the effect of progesterone is diminished, these uterine contractions cannot be initiated. Okay, now towards the end of gestation, as you can see, somewhere in between 36 to 40 weeks. Okay, so as you can see over here, the level of estrogen, it rises sharply, right, towards the term completion of the 9 months. Okay, level of estrogen, it rises sharply, and as you can see, progesterone levels are declining. Okay, so the levels of estrogen, when it increases, it overcomes the action of the progesterone. Okay, so this increase in the estrogens, it results from the increase in the secretion of certain placental hormone. Why it rises suddenly? That's because of the release of corticotropin releasing hormone. Now corticotropin releasing hormone, it is the hormone released from the hypothalamus, right? So this particular hormone, what is the action of this particular hormone? Corticotropin releasing. What is corticotropin? Yes, it is the ACTH, right, adrenocorticotropic hormone. So this hormone CRH, that is corticotropin releasing hormone, it acts on the pituitary gland of the fetus. Okay, now these actions are produced in the fetus. Okay, so the fetal adrenal glands, they are acted upon by the ACTH, okay, which is released from the pituitary gland. So we are all aware of that ACTH, it stimulates the adrenal gland to produce more and more and to secrete more and more cortisol and the dehydroepiandrosterone. Okay, so these hormones released from the fetal adrenal glands, okay, these are actually the source of the estrogen. So this hormone dehydroepiandrosterone, it is converted into estrogen by the placenta. This is how the levels of estrogen are increased. Now these high levels of estrogen, they cause the increase in the number of receptors for oxytocin on the uterine muscle fibers. Okay, so this is the position of the baby. Now the baby is in the uterus, but due to high levels of estrogen, it acts on the walls of the uterus. It's the middle layer, the myometrium, the muscle fibers. On these muscle fibers, the number of receptors for oxytocins are increased. So due to the increase in the receptors for oxytocin, now oxytocin, it is the hormone which is produced by the, or it is secreted rather by the posterior pituitary, right. It is actually produced by the neurosecretory cells, right. Posterior pituitary, it does not synthesize any hormone, we have seen, right. So it just stores the hormones which are produced by the neurosecretory cells. Okay, so axons will carry these hormones ADH and the oxytocin, which are produced by the nuclei in the hypothalamus, and it will be just stored in the posterior pituitary, correct. So as the number of receptors for oxytocin are increased on the uterine walls, the oxytocin which is released by the posterior pituitary, it will act on the uterine muscles and it will stimulate the uterine contraction. So contractions of this wall of the uterus will be increased. So also the relaxin, remember the hormone relaxin which we have considered in the last video. So this hormone released by the placenta, it increases the flexibility of pubic symphysis and also dilates the uterine cervix, right. That is what we have seen. So this is the cervix which is now dilated, right. So that the baby has been pushed through the cervix. So as you can see, the head of the baby is in the cervix of the uterus, right. Okay, so it pushes the baby towards the exterior, towards the cervix, which was in the uterine cavity earlier. Okay. Apart from that, estrogen also stimulates the placenta to release more and more prostaglandins. Now these prostaglandins, it induces the production of certain enzymes which digest the collagen fibers in the cervix. Okay. So this cervix which was stiff now accommodates the baby, right. So what helps in dilatation of this cervix? The cervix should become soft to accommodate the baby which is passing through, right. So it is aided again by the estrogen which stimulates the release of more and more prostaglandin. Prostaglandins in turn will increase the production of certain enzymes which will digest the collagen fibers in the cervix, so that it will soften and it will aid the movement of the baby through the cervix into the vagina. Okay. Now this oxytocin hormone, it has now initiated the uterine contractions, right, but the control of these labor contractions during the childbirth, this occurs through a positive feedback cycle. Now what is a positive feedback cycle? We have always seen a negative feedback cycle, right, in which if certain hormonal levels are high, supposing if certain hormonal levels are high, what happens? it acts mainly on the hypothalamus, right? Hypothalamus to secrete less of the releasing hormone. Okay, so this is just an example which I have taken up over here. So under the endocrine system, we have seen that the feedback mechanism takes place, right? So high levels of certain hormones, it will decrease the hormones, the releasing hormones from the hypothalamus, right? So as a result of this, the releasing hormones will not be released from the hypothalamus. In turn, the action on the anterior pituitary, these are ruled out. Okay, so in turn the secreting hormone levels are also decreased, right? Okay, so this we have considered several examples. So this is a feedback mechanism, a negative feedback mechanism. Okay, that is high levels of the hormones, it will act on the releasing hormones to be decreased. But that is not the case with the hormones which are controlling the childbirth. Now over here positive feedback cycle is acting. Now what we have seen, usually the oxytocin, it initiates the contractions of the uterine wall, right? Now why it is happening? Why more and more oxytocin? Now initially low levels of oxytocin will be released, but later on as the parturition continues, more and more oxytocin will be released. Now why it is happening? Okay, that's because the contractions of the uterine myometrium, it forces the baby's head or body into the cervix, right? So what will happen? This cervix, it will be distended, right, or it will be stretched. So there are stretch receptors in the cervix which send the impulses to the neurosecretory cells in the hypothalamus, which are releasing these hormones, that is oxytocin. Okay, so as a result of stimulation of the stretch receptors, hypothalamus is activated and more oxytocin is released into the blood capillaries of the posterior pituitary gland. So as the hormone oxytocin, it is carried by the blood to the uterus. Now on the uterus what has happened? More and more oxytocin receptors have been presented, right? So it will stimulate the contraction of the myometrium more forcefully. So as the contractions of the uterine wall increases or intensifies, the baby's body, it stretches the cervix still more as it is being pushed through the cervix, right? So more and more stretching of the cervix will take place, more impulses will be stimulated, they will be sent to the hypothalamus, there will be yet more secretion of the oxytocin. Okay, so this is a positive feedback. So more and more hormone is being released, okay, by this feedback mechanism. Now after the birth of the infant, this positive feedback cycle is broken. Why? Because as the baby has passed through the vagina towards the exterior, the stretching of the walls of the cervix, it will be lessened, right? So no impulses will be sent to the hypothalamus, less of oxytocin will be released. Okay. Now these uterine contractions, these occurs in the form of waves, as we have seen the peristaltic waves in the GIT. So these are quite similar to that. Okay, so it starts at the top of the uterus and it will travel downwards. So due to this particular fashion of uterine contractions, it eventually expels the fetus out of the uterus through the vagina. Okay. Now this labor, it initiates certain indications which will tell you the labor or the childbirth has initiated. Okay. Now there is something called true labor and false labor. Okay. Now labor, it is associated with intense pain. Okay. So labor pains are initiated as the contractions of the uterine wall are initiated. So how you will identify whether it is a true labor or whether it is a false labor? So there are certain indications. So true labor, how you will identify? It begins when the uterine contractions occur at a regular intervals, producing intense pain. and as the interval between the contractions shortens, the contractions also will intensify, more contractions will be occurring. One more indication of true labor is that localization of the pain will take place in the back, and this pain will be intensified after walking. If the lady walks, this pain will be intensified. Apart from this, a more reliable indicator of a true labor is the dilation of the cervix. So, cervix will be dilated completely, round about 10 centimeter. Okay, so this is the indication of the initiation of the true labor. Apart from that, there is something called show. So, it is called a show. Now, what is a show? It is a discharge of blood containing mucus in the cervical canal. Okay. So, due to the rupture of the amniotic sac, there will be a small discharge of blood containing mucus into the cervical canal, and that is known as a show. So, this is the indication of the true labor. Now, how you will identify whether it is a false labor? Okay. So, supposing if the pain is felt in the abdomen at regular interval, but it does not intensify, then it is said to be a false labor. Even if walking does not alter it significantly, what we have seen under true labor, walking will intensify the pain, right? Supposing if walking does not intensify the pain and the pain is mainly in the abdomen, not in the back, then it indicates that it is a false labor. It is not a true labor. So, also there is no show. Show means what? There is a discharge, right, of the blood containing mucus into the cervical canal. If it does not occur, it indicates that it is a false labor. So, also if there is no cervical dilation, then it indicates that these labor pains which are initiated, these are false ones. Okay. Now, coming to the stages of the true labor. So, there are 3 stages of true labor, that is stage of dilation, stage of expulsion and placental stage. So, these are the 3 stages into which this true labor will occur. Okay. So, coming to the first one, that is stage of dilation. So, this stage lasts from the time from the onset of labor, onset of the contractions to complete dilation of the cervix. So, this is called as the stage of dilation. So, where the time when the contractions are initiated and the baby is pushed into the cervix, the head of the baby is pushed into the cervix, the complete dilation of the cervix has taken place. So, this particular stage may last for 6 to 12 hours, and the characteristic features of this particular stage is regular contractions of the uterus will begin. There is rupturing of the amniotic sac. As you can see, the amniotic sac has ruptured and complete dilation of the cervix has taken place, that is up to the 10 centimeter. Okay. Now, sometimes the amniotic sac does not rupture spontaneously. So, at that time intentionally rupture of the amniotic sac needs to be carried out to facilitate the parturition. Then the second stage is the stage of expulsion. So, it is the time from complete cervical dilation to the delivery of the baby. It may last from around about 10 minutes to even several hours in certain ladies. Okay, so, this is the stage of expulsion where the baby is pushed out of the cervical canal as well as the vagina towards the exterior. And the third stage is the placental stage. So, this is the time after the delivery until the placenta, okay, the placenta or the afterbirth, it is expelled by the forceful contractions of the uterus. So, this is known as the placental stage. Okay. So, these contractions also are protective in nature, in that they will constrict any blood vessels which are ruptured. Okay. So, these are constricted so that the hemorrhage can be prevented. Okay. Otherwise, what will happen? Excessive bleeding will take place and hemorrhage might take place. So, that can be prevented by these uterine contractions. So, these are the 3 stages of the true labor. So, this particular labor, it may last longer during the birth of the first baby. If it is the first time, usually the labor may last for 14 hours. Subsequently, the labor may last round about 8 hours. Okay, but of course it may vary from female to female, it may vary, the duration may not be the same in all the females. Okay, now as we have seen, the baby, as it passes from the uterus into the cervix and then through the vagina. Okay, now uterus is extended, right, it is distended, but what about the cervical canal and the vagina? Okay, the baby, as it passes through the cervix and the vagina, okay, it is known as the birth canal. So it is squeezed through these narrow openings, right? So it is being squeezed for several hours through this birth canal. So it will induce a stressful situation. The childbirth is actually a stress for the fetus, right? So it's a fetal's head, it is compressed for hours together. Also some degree of intermittent hypoxia, that is decrease in the oxygen level, may take place because the umbilical cord is compressed. Okay, even the placenta is compressed during the uterine contractions. Okay, so hypoxia may be produced. So in response to this stressful situation, the fetal adrenal medullae, they will secrete the hormones epinephrine and norepinephrine, or adrenaline and noradrenaline. So we have also seen that these are the hormones of fight and flight, right? So during any such stressful situation, epinephrine, norepinephrine are released, right? Okay, so much of these stressful situation of the parturition, protection is afforded by these two hormones. Okay, so also it prepares the infant for the survival in the extrauterine life now. Okay, also certain other functions include, it clears the lungs which were filled with the fluid until the baby was in the uterus, right? So these are cleared, alter physiology of these lungs so that they are ready for breathing the air. Also these hormones mobilize the nutrients for cellular metabolism, also promotes the increased blood flow to the vital organs like brain and heart. Okay, so this is to do with the parturition or the labor. Now in 7% of the pregnant women, usually parturition or the labor does not occur even after 2 weeks of completion of the term. Okay, so now in this situation, when the natural labor is not initiated, there is a risk of brain damage to the fetus. Even fetal death may take place because the placenta is aging, right? So there may be inadequate supply of oxygen and the nutrient. So it is risky. So in such cases, post-term deliveries may be facilitated. Okay, so the labor needs to be initiated sometimes by administration of the oxytocin to such females, or sometimes if the labors are not initiated even by oxytocin, surgical delivery is carried out, that is known as cesarean section. So operative procedures are carried out for the childbirth. Okay, now following the childbirth, after the childbirth has taken place and after the expulsion of the placenta, there is a 6-week period which is required for all the reproductive organs and their physiology to return back to pre-pregnancy state. Okay, so there is alteration in the physiology, right? So it takes 6 weeks time for it to come back to normal, and this is known as puerperium. Okay, apart from that, the uterus, it also undergoes remarkable reduction in size, and this is known as involution, okay, due to tissue catabolism. Okay, cervix, which was elastic, more elastic or more stretchable, it regains its pre-pregnancy firmness. It will become more firm now during this particular period, and round about for 2 to 4 weeks after delivery, there is a uterine discharge known as lochia. It initially contains the blood and later the serous fluids from the site where the placenta was attached. Okay, so this is to do with the labor or the parturition. This is the reference for my presentation. Thank you for watching.